tumor necrosis factor agent. It blocks TNF. TNF produces inflammation, let's block it. This drug affects interleukins and so on. And because these things are usually antibodies, monoclonal antibodies, means there's one antibody to just that thing, and they're biologics and they're marketed by drug companies, you better bet your sweet butt they're expensive. Okay. Okay. Bradykinin and substance P are a couple of other substances. These are actually, if we look at pseudounipolar sensory neurons going to the skin. So this is the skin right here. This is the area innervated by that nerve, and then going into the spinal cord, right? Bradykinin and substance P, the neuron actually makes these substances and packages them in little granules. So that out here, in the end of these nerves, you have these little tiny granules of substance P and bradykinin. So what happens is, I get a bee sting here. That stimulates pain, obviously. So the pain is going to go this way. The action potential. But the action potential also goes everywhere else. And you wind up releasing substance P and bradykinin from these terminals. It's like a neurotransmitter, but you're not transmitting anything to another neuron. You're releasing these substances locally. And what do these things do? They're chemoattractants. If you go to the next slide, or the next one after that, I can't remember exactly where they are. Bradykinin, right there, increases vascular permeability. Substance P does as well. So that produces the tumor. You get swelling. You're recruiting the inflammatory process. Here's one for you, in case you're on jeopardy. This is one for you. There's a common drug to treat hypertension. They're called ACE inhibitors. You guys heard of those? ACE inhibitors. Angiotensin converting enzyme inhibitors. Everybody's parent is probably on an ACE inhibitor. If you have diabetes, you need to be on an ACE inhibitor. Everybody in Oklahoma is on an ACE inhibitor. If you're not, you better go get you some. Angiotensin converting enzyme is the degrading enzyme for substance P and bradykinin. So in addition to its role in converting angiotensin 1 to angiotensin 2, it also breaks down substance P and bradykinin. So if you're on an ACE inhibitor, bradykinin and substance P can build up in the tissues. And that is manifested by cough. Because it collects in the trachea and they cough. That's a side effect of ACE inhibitors. And it has to do with the accumulation of ACE, substance P and bradykinin. Cough is a part of an inflammatory, a reaction to an inflammatory process, right? There you go.
So that's like the lisinopril cough?
Pardon me?
The lisinopril cough?
Lisinopril, anything ending in an ill is an ACE inhibitor. Lisinopril, if you look on Google, what's the number one side effect of lisinopril? It's cough. Amber Hicks, upstairs, she's been coughing for 2 freaking months. I didn't realize until the other day, her cardiologist put her on lisinopril 2 months ago. It's not a bronchitis you have, it's the freaking lisinopril. And it's a class effect. Every lisinopril will cause it in people who are susceptible to it. And it's a pretty high number, it's like 20%, something like that. It's a huge side effect. But you understand how it works now, right? Any other questions related to it? Okay, so I put these slides in here so you can just go through there and look through it. I mean, it's pretty interesting how these things work. Vasodilation is interesting. Nitric oxide there, sildenafil, Viagra, what's the other one? Cialis. They produce vasodilation and erection by blocking, but they're not blocking, they're stimulate the production of, they block the degradation of nitric oxide. That's how they work. And you have an erection. Prostaglandins here. How does aspirin and Motrin, ibuprofen, reduce fever and pain? Because the cause of fever and pain is in large part due to prostaglandins. How does aspirin and ibuprofen work? They inhibit prostaglandin synthetase. If you inhibit the formation of prostaglandin, your fever goes down and your pain goes away. Why don't you take a break and just chill out for a few minutes, and then we'll come back and start all over. See, everything, so if you haven't figured out, everything I tell you, it makes sense. It makes perfect sense. So, go pee potty.
No, I'm about to. I know, I'm so mad at myself this morning because I had old, like, not hot warmers in my pockets, right? And I took them out and I threw them away. And I accidentally threw away one of the good ones that I just, because I like went to put them in there, I was like, oh, there's more. So I grabbed the ones that I couldn't feel any heat from. And I had just turned them on, so I was like, okay, let's go over and I did a joker. And I was sad. You can, hold on. Yeah, I got it. Got it? Oh, that's so it's not foreign objects to my elf on the shelf for Christmas name is Omri.
He was a cardinal. He was a cardinal. I think it's like approximate plus something else. You're like the Hulk, but with migraines.
The second I like start to relax, it's like
It was,
so I just stay high strung and all.
You made me hold my breath there and you came with nothing.
well, I do know what the class average was, but one of the exams got, there was a problem with the grading of one of the exams, and that person already knows about it. So that threw it off. So it was around 80.
Okay.
Around 80.
So the grade changed, you said?
No. This isn't one person.
We all have those.
We done well. We done good.
Solid 10 points.
Passes.
9.5,
Okay, well, A, there were no laces on it. I had to go buy the laces. Okay. Yeah. We put laces on the shelf. B, come on. I can't afford to. Why you just donate?
She said something.
Oh, God. I looked at it and I was just like, and I walked off, right? And I was just like, I'm not going to do it, right? And then next time I walked by, I was like, no, I say it. That's cool. Would you see? I'm not the person.
You know what I mean? Like, that's some theory.
And I was like, so many people just donate for me. Just like,
Concentration of whoever at the bottom of the.
I know. They were, you know, there's like spider webs set up and stuff like that. So like, I had to clean them out and like find the laces. Oh yeah, definitely. Like it wasn't just like a, yeah, it wasn't like a glorious like thing. Yeah.
They changed the jersey.
But it's like, and they're like not even
He should get up and go when he tells us to.
Put non-frozen water in there.
I wasn't talking about now. Oh, he's not on the grading sheet. I just know they're like grading sheet. I think that's the concentration that yeah. After the big it like separates it like
Oh, because I was like, I didn't know
Watched it before. So Stacey's been on this one. And so she watches from last year. And so
cool.
I'm like, maybe I'll do that for the next set and see if I like. Yeah. So I'm going to try that. Because I used to like listen to it first and then come and rewatch the same one. She said like every night she watches the one that we're about to do. And like on the weekends she'll watch it at like 2 times speed and be like, got it.
Sounds good. Well, I don't like frameworks in my life. But I don't like plus I feel like every time I get really that
It's a little longer.
I was gonna say I've been looking for some time now.
There's like tomorrow, we have 2 lectures. I watch 2 lectures. I'm gonna lose so much sleep this year. I'm gonna lose a lot of sleep this year.
about like what's the most effective.
That's what I'm trying to do.
So let's go ahead and move on.
Somebody asked for it.
If you look at this list here, if you look at this list, as I was during the break here, so histamine, if you want to block the inflammatory response, everybody knows about Benadryl and non-sedating histamine, antihistamines, Zyrtec, Claritin, and so on. Leukotrienes are another type of inflammatory mediator. Leukotrienes. Anybody here on Singulair? Well, that's a leukotriene inhibitor. That's where you're working there. Very popular allergy, asthma medication. Tumor necrosis factor, the interleukin blockers are the biologics that you see advertised on TV so much. The mast cell stabilizer is one of them it's called cromolyn sodium. Anybody here on cromolyn sodium? It's Intol there's an inhaled thing. Nobody's on that? Okay. It's usually not that popular. One of the times it's used a lot is during people who have exercise-induced asthma. That's a good, effective treatment to prevent that. Okay? So you're going to be using drugs that affect most of these, a lot of these chemicals as you get on here. Manifestations of acute inflammation. Systemic is interesting. And these are obvious. Anytime you have sore throat or the flu, you have all of these symptoms related to it. The WBC count, it says left shift. So the left shift is, if this is a seg here, I said you normally have, the normal WBC count is 4 to 10,000 per cubic, not centimeter, per cubic millimeter. If these things occupy 60% of the circulating white blood cells, if we just say 10,000, you would expect there to be 60,000 segs. Right? During an infection, because segs proliferate and they leave the marrow in great numbers in inflammation and in bacterial related infections, the number of segs, so this is 60%, right? The number of segs, if you take and count 100 white blood cells, the number of segs can go up to 90%. This is suggestive of a bacterial infection or an inflammatory process. The total white blood cell count will also go up, say 15,000. So not only does the white blood cell count go up, the percentage of segs goes up. So that increase is due to segs.
So then the 6,000 will go up.
Yeah, big time.
It'll be 90% of like.
It'll be 90% of this. 90% of that is minus 150, it's 13,000. Okay? Well, I think it's actually 13,500, if you want to be exactly correct. Okay? Now also, to get these number of cells to ramp up that quickly, you start pushing out, the marrow starts pushing out immature segs. And these immature segs The nucleus hasn't had time to segment yet. It looks more like a band. Normally in your circulation, you have, if you look at all the segs, you have about 4% of them are bands. In an infection, the band count will go up because you have more immature cells. You may get a band count of 8%, 10%, 12%, whatever. The presence of an increase in bands is called a left shift. An increase in the number of bands is called a left shift. And just for completeness sake, viral infections will increase the number of lymphocytes. An increase in the number of lymphocytes is called a right shift. So a left shift indicates bacterial infection or inflammatory or trauma or something like that. A right shift, generally, typically, that sort of redundant means a viral infection. That thing there called a leukemoid reaction, in some people, and I've only seen it twice in my career, you get a white blood cell count on somebody, and it'll come back 50,000. What? 50,000. White blood cell count will rarely go above 20,000, regardless of what the inflammatory response is. Pain or pneumonia or ischemia or anything like that, it rarely will go above 20,000. All of a sudden you got a 50,000 white count. An absurd white count is called a leukemoid reaction. The first thing that should be on your differential diagnosis, a differential is the list of your possibilities it could be. You're going to learn about differential diagnoses here at the end of this course when we have our H&P week. But the first thing, if I saw a 50,000 white count, the first thing I would think of is leukemia. But you always have to consider leukemoid reaction on that differential too. And leukemoid reactions are always present in the presence of an acute inflammatory process. It's interesting, the first one I ever saw was in a little kid. And little kids, the primary cancer in little kids is leukemia. She had a 50,000 white count, put her in the hospital. The next day, it was absolutely normal. She had pneumonia. The next day, it was absolutely normal. So no leukemia. It was just a leukemoid reaction. Acute phase reactants. These things are proteins that are present in the blood in the face of an acute phase, an acute inflammatory process. These are proteins that are in the blood that increase in the face of an acute inflammatory response. In other words, if you have rheumatoid arthritis, they don't go up. But if I burned your skin, or if you burned your skin or something, then they will go up. Or if you had suddenly a torn ACL, something like that, you will have an increase in these acute phase reactants. And the one that's very popular is CRP. It's C, the letter C, capital C, hyphen, reactive protein. C-reactive protein is what it's called, CRP. Normally you have low levels in your blood. During an acute inflammatory process, it goes up. So if you come in with sudden back pain, oh God, I woke up with this. I can't straighten up. CRP. I mean, if somebody came in and suddenly they couldn't stand up because of back pain, then what is the differential? Okay, well, you slept wrong on it, you got muscle spasm, that's an acute inflammatory process, that's one thing. There are a whole bunch of other things that could be on the differential that are bad. Like some cancer has now manifested itself in your back, or you know, you have a herniated disc or something, you know, the list goes on and on and on. But if you got a CRP, it would be elevated.
So there's certain proteins in the blood that would show up on that are increased to show that?
Well, you have to specifically order a CRP. It's not part of the panel. All right? Complement, I'll talk about complement here in just a little bit. Complement is a series of multiple inactive enzymes that are in your blood. During inflammatory processes, they become active and can produce, help you, that's where it gets its name. It helps the immune response. I'll talk more about it in a minute. Fibrinogen is, we'll talk about fibrinogen when we get to hemodynamics, but it is responsible for the reload phenomenon. Now, if I draw your blood into a tube without anything in it to prevent clotting, it's just I draw some blood into a tube and sit it there, you know that blood will eventually clot, right? So what I'm going to do is I'm going to let it sit there for an hour, and I'm going to look to see how far down that tube, how many millimeters down that tube the clotted blood starts to pull, right? The clotted blood is going to be heavier, it's going to fall out, right? That is called your erythrocyte sedimentation rate. I don't know how many minutes they let it go, but that's what it is. It's the pooling of the blood. Your normal ESR is about 15 millimeters an hour. In the presence of the reload phenomenon, if you have all these blood cells that are stacked on each other, so that there's a string of them, they are heavier than a single blood cell. They will precipitate faster or further over the same amount of period of time, right? So an ESR will go up. You might have an ESR of not 15, but 30, or over 100 millimeters an hour. I've seen them that high. That tells you that there is an acute inflammatory process going on. It's non-specific, but it's a good indicator. You don't have to order a CRP and an ESR. It's the same thing. They're both acute phase tests. Get one or the other. Everybody follow that? All right. Patterns of inflammation. Now we get to the good stuff. All of these things right here are in the next slides. Okay? So I'm just going to kind of breeze through them here and give you a little bit of a word or two about them. Wheal and flare, that's what superficial skin reactions to antigens produce. You don't necessarily have to penetrate the skin. You rub up against poison ivy, poison oak, poison sumac, it produces a wheal and flare type of reaction. In some people, you can take your skin, your fingernail, and just draw on them and give it a little time, and that trauma will produce an inflammatory response in the pattern that you've made, like scratch. That's called dermatographism. It's kind of cool. The guy on the right there, this is allergy testing, like ragweed and stuff like that. They inject these things into the dermis, like your TB test. The TB test is like, produces a wheal and flare. Okay. It goes away quickly once the offending allergen is gone. the thing about things like poison ivy is it produces a delayed hypersensitivity. It's not that day that you're going to wind up with it, it's the next day, and then maybe the following day, more will pop up in another area. Wherever that oil got in touch with your skin, you're going to, if you're susceptible to it, you're going to react to it. And because skin is different throughout your body, you're going to react at different times. Listen.
Is that mosquito bites?
Mosquito bites, yeah, you can say that. Mosquito bites, bee stings, mosquito bites.
Do you have to be susceptible to the poison ivy to get it?
Yes. And the more exposure you have to it, you will eventually become allergic to it. I have a friend of mine, he can go romping naked through it and he doesn't react to it. I look at it and I break out. But you give him time and he's going to wind up becoming allergic to it. I just became allergic to it at a much younger age. So, serous inflammation is, as it says here, one producing a serous exudate. This is an example of like a friction burn or a sunburn. You also see these types of things. It says includes effusions of joints. If I were to go outside and run up and down the stairs, a bunch of stairs, or I decide I'm going to be a weekend warrior and go do something, play paintball thing, run around in the woods and that sort of thing, then my joints are going to let me know. And one of the things they do is you wind up with a joint effusion. Effusions into the pericardial sac, we'll get into in anatomy later on. Effusions into the pleural space because of congestive failure and things like that. Effusions into the peritoneum, I gave you ascites from liver failure or cirrhosis. One of the most common causes of effusions into the pericardial sac is malignancy. That's on the differential. Catarrhal inflammation is an inflammatory response involving the mucous membrane. That's the bottom line. And it can be anywhere from a snotty nose to conjunctivitis to otitis media in that top left panel that's looking through the eardrum. You see pus inside the middle ear. On the right side, that's a trachea, the autopsy specimen, showing inflammatory process of tracheitis from whatever. It could be a chemical induced, they inhaled a chemical or something like that. It could be infection. Most of the time, it's usually doing more of a chemical related thing. Suppurative inflammation is inflammation. Suppurative means pus. So if you have a suppurative process, that means there's pus. That guy's armpit right there, you see that right, the top right panel, that's a disease called hidradenitis, H-Y-D-R-A-N-itis, hidradenitis suppurativa. These people, they form recurrent furuncles and carbuncles. This person at the bottom has it in the inguinal area. They usually have it where you find apocrine glands, in the axilla and in the inguinal area and in the perianal region. Oh.
Can that be treated by turmeric?
By what?
Turmeric, it's a plant. One of my friends had it, and he said that he Googled it. He didn't go to a doctor, and said that like turmeric pills, can treat.
I've never treated it with turmeric. I've never heard of that. But,
oh, okay.
The treatment for hidradenitis, really, the definitive treatment is to surgically go in there and they strip all the glands out of the armpits. They're always infected with MRSA. You don't even treat them with antibiotics. For one reason, antibiotics do not penetrate abscesses. They do not penetrate into abscesses. The only reason to put somebody on an antibiotic is if you have surrounding skin that was red, like erysipelas. But the abscess itself, you don't necessarily have to treat at all. The infectious disease guys, they don't treat it. Just drain it and keep it open and let it heal from the inside out. This is an infection right here, a staph infection of the, under the nail there. It's called a paronychia, right there. It says also seen, well, paronychia can be, there are several risk factors, but one of them that I see frequently is the women go get the mani-pedi and they push the little thing, cuticle back, and they wind up getting infected and they come in with a digit that looks like that. All you do to it is you do a digital block. You put lidocaine down here, anesthetize the whole finger, and then take a number 11 scalpel blade, which is very sharp and pointed. You just slide it up underneath between the skin and the nail, and it releases all that pus, and they have immediate relief. Then put them on an antibiotic because the skin here is infected. Okay? Because it's usually staph, you would use and because staph has a high resistance to the penicillin, you would use something appropriate to treat it. There are a bunch of different options for learning. Okay? These babies right here, you stick a scalpel in that, you can see that it's been worked on, but you see that it already has 2 pus channels right here. Basically, to open that up, you take the scalpel and stick it in here and draw it all the way across to there. You just connect the dots, and that opens 2 of the compartments, and that's how you treat it to get some relief there. The Good Shepherd 2 weeks ago, the nurse practitioner asked me to see a patient who had this going on. But it was in her labia majora. We'll talk about it when we get there. But it was just huge, and I just want to stick a scalpel in it so bad because it was just full of pus. But that type of thing at that clinic, you need more follow-up than we would be able to give her, so I had to send her to the emergency room, regrettably. So abscesses are basically, as it says here, a collection of pus in a naturally occurring, or they actually, you can create the chamber. Here is an empyema of the gallbladder, and you can see it's in a stainless steel something, and they just open the gallbladder to show that it's just full of pus. So obviously this is a cholecystectomy. Here's pus that you see in the lungs. This is when you're on board question, one of the organisms that produces pus-filled abscesses in the lungs and pneumonia is pneumonia caused by staph. Strep pneumoniae is the most common type of community-acquired pneumonia, but it's not always. You know, you only have about 60% of it due to strep. If the infection is due to staph, be wary that when they're healed, they don't form abscesses within their lungs. It usually have to be drained or at least watched. Here's an abscess, a perianal abscess right here. I don't like sticking scalpels in those. When we get to anatomy, into the anal region, you'll see that what looks like a little bitty abscess on the surface can be a mongo abscess underneath the surface. That's why I don't like sticking those. I refer those out to general surgery. This is a collection of pus around the lungs, on both sides actually. This is not within the lungs, but it's around the lungs due to infection. Pleurisy, for example. Lymphadenitis, lymphangitis, and lymphedema are three different processes going on here. Lymphadenitis is swollen lymph nodes. You know, when you get the sore throat, you get the swelling right here, the submandibular nodes will swell. This swelling right here is due to an infection called lymphogranuloma venereum that you see up there. You can, a big swollen node can often rupture to the surface, and you wind up with draining pus out these things. That's called a bubo. The bubonic plague, these people had these things all over their body. Gonorrhea, chlamydia, syphilis, chancroid is another sexually transmitted disease that's present in healthcare, not healthcare workers, sex workers in third world countries. The organism is Haemophilus ducreyi, D-U-C-R-E-I, something like that. I think there's a Y in there. Haemophilus ducreyi. It's not like, yeah. It's not Haemophilus influenza, which is a type of pneumonia. This is Haemophilus ducreyi, produces chancroid. And of course, tuberculosis. So, you know, when I say things like that, almost in passing, you know, what's the cause of chancroid, it's Haemophilus ducreyi, that's something you should commit to memory. Because it's a board question, you're going to be seeing it. And for those of you that visit sex workers in third world countries, you probably ought to know this. You know, why all of a sudden, you know, you look like that. So, and you know who you are. Okay, so here's a little lymphadenitis right here. This all right here is lymphedema. So we know what lymph channels are. It's where your extracellular fluid is drained back into the venous system. We'll talk more about it when we get to the chest. But these are lymph channels that are blocked. I don't know what's blocking it in this leg right here. Cancer can do it. And this person right here, you see this arm is huge compared to that one. A lot of times this happens during mastectomy, and they go in and do a lymph node resection of the axilla. This is a common problem in women who have had that done. The affected side's arm will swell because of the lymphedema. So the extracellular fluid is not being able to be withdrawn from the limb through the normal lymph channels. You'll see this a lot in practice. If you go to the mall or Walmart or something, look around, you'll see somebody with lymphedema. Okay, fibrinous inflammation is a coagulative type process. Fibrin is present, and the fibrin will form adhesions. You see this a lot in pericarditis. Oh, excuse me. I have a partial, and I had my teeth knocked out by baseball when I was in 7th grade. That has never happened in my life. I just get so wound up. I shot my tooth. Got carpet buzz on me. I hope that's on film. That's going on the board. Really, you know, I never told my wife. We were married 5 years before she ever knew I had a partial. You know, I just never take it out. You know, people, they put their teeth in cups, you know, to clean them at night. I never take mine out. Ever. And it's just, that's the first time I've ever done it.
What tooth is it?
Okay.
April's asking what tooth is it?
What tooth is it?
Huh?
What tooth?
I'm not gonna tell you.
Look, he's small, I can tell.
No, you can't.
Never
There's no way. The other thing is, when I went home over Christmas, my dad had a shoulder surgery. And so I went home to take care of him for a week. And so he has full dentures, top and lower. So he said, you put, Everdent, that sort of thing. And so he said, go get a cup and put about, a half an inch of bleach in it and fill it up with water. For what? For my teeth. He soaks his false teeth in bleach. Right out of the laundry room. Bleach. Clorox, bleach. Just rinses them the next day. I said, how long have you freaking been doing this? He said, 40 years. So I guess it works. Okay. We had, it's kind of funny because I'm friends with all these dentists and stuff. No, I can't say it because that can was rolling away. Anyway, one of these days I'll tell you a story. So anyway, okay, fibrous inflammation. Pericarditis or a pleurisy infection, involvement of the pleura. Well, you're not going to listen anymore. You're done. All right. When we get to there on the cadavers, probably you'll see that some of these things, when we try to open up the heart, it's stuck together, it's adhered. That's due to this type of inflammatory process. As a matter of fact, when you put a chest tube in somebody, you make the hole in the chest with an instrument, but then you stick your finger in there and run your finger around to make sure that the lung is not adhered to the chest wall from this type of inflammation before you go sticking that tube in there. You don't want to jam a chest tube into the lung itself. It needs to go into the space between the wall and the lung. Okay? They call it bread and butter pericarditis, but that's what it is. Serosanguinous, sanguinous means blood. So what you have here is a bloody type of process going on. So that's bleeding right there. Serous inflammation would be just clear fluid. Serosanguinous is thin, bloody fluid. Not blood, not the thickness of blood, but a thinned out blood. That's serosanguinous. Ulcerative inflammation, this describes the 4 different stages of decubiti that we've been over in anatomy. So that just gives you some illustration on that. A lot of times during a skin repair, the arteries into an area, if you're going to repair it, you've got to have a blood flow to it. And the neovascularization, the new vessels that are form in a spiral type of fashion. So when you do a section here, you section through the spirals. For those of you that menstruate, every month you grow a new uterine lining. Well, what accompanies that new uterine lining growth are the spiral arteries. You slough those arteries, that's what's bleeding along with the lining when you menstruate. Other types of ulcerative inflammation where it's just a break in the surface. You see this all too often in Oklahoma, especially down around Hilton. You were a dental assistant? What? Hygienist, dental hygienist. You see this a lot down around, there are way too many teeth for Hilton, but you see this quite frequently. You can't really do much to cure diabetes in a mouth that looks like that. You got to fix the mouth as well as the diabetes. Ulcerative colitis here is, you can see how hemorrhagic that looks. And then over here is, it says duodenitis. This is like ulcer disease, peptic ulcer disease. Ulcers, stomach ulcers, most of them are not stomach ulcers. 90% of ulcers that you're taking Malox for, or the PPIs, the proton pump Prilosec, the Tagamets, most of those ulcers occur in the proximal duodenum, not in the stomach. Okay. And gangrenous inflammation, well, that goes without saying here. It's just dead tissue from frostbite up here, or from necrotizing fasciitis. This little kid right here, as it says here, the kid died eventually because of the infection. Toxic shock syndrome from the tampon use, the superabsorbent tampons. What were they called? OB. You're probably too young to remember. There was a tampon that was advertised on TV. It was a superabsorbent tampon that was created by a gynecologist. It was called OB. And it was, the problem was women were using it and leaving it in, and they would wind up with staph infections. Staph produces a toxin, and that's where you get the toxic shock syndrome, because it affects the hemodynamics of the body. It's really a nasty thing. So now, that's why you don't see those super duper absorbent tampons, because they don't want you leaving them in so long. You want you to change it more frequently. Although I gotta tell you, my wife sent me to the store to get tampons one time, and this was in Cayman Brac, where we go vacation all the time, and things are different down there. So I don't know, like when it says the descriptions, I don't really know what they are. I mean, I know how much your menstrual flow is in milliliters per day, and the average day, and all that kind of thing. I can tell you all about that, but I don't know anything about like dealing with it, right? So I come back with these things. Here you go. And no, it wasn't tampon. It was pads, right? So I come back and say, here you go. And they're like this big. It was kind of funny. It's like made for, I don't know who. Definitely not her. Pseudomembranous or membranous type of inflammatory processes, you're going to run into this. You know the gray membrane of diphtheria we talked about? That's a pseudomembrane. Or it's actually a membrane. You can peel it off of there, right? The one that's you always fear is Pseudomembranous Colitis. This is a potentially deadly disease caused by an overgrowth of the bacterium Clostridium difficile. Clostridium difficile, you normally have in your colon, along with 50 billion other types of bacteria. But when you take antibiotics, for example, you wipe them all out, but Clostridium difficile is resistant to most of them. It overgrows, produces these types of pseudomembranes that you wind up, you can wind up in pretty serious, it can kill you. So anytime, one of the most common side effects of antibiotics is antibiotic-induced diarrhea. Well, you have to determine, is it antibiotic-induced diarrhea just because you jacked with the normal flora of the colon, or is it Clostridium difficile? And there's actually a test for this that you want to get. You don't want to ever miss this. Here's the complement cascade. And you don't need to spend a lot of time on this, other than to say that the complement involves a whole host of proenzymes that are present, and then when in the presence of some type of antigen, they activate, it can produce one of these types of cascades to aid in the immune response. And one of the things that it does is it says right here, the membrane attack complex, the MAC complex. Remember I talked about perforin over there with CD8 positive cells? The same thing happens with the complement cascade that you see here. You get these proteins that assemble attached to the cell membrane of the bacterium or whatever and can destroy it. Okay? I don't think I've ever run a test on the complement system in my entire career. But if you work for allergists or transplant teams or stuff like that, you're going to be having to deal with the complement system. Chronic inflammation, well, basically, if the acute inflammation doesn't clear, it's chronic. There are all different types of reasons for it that you see here. Silicosis is people like who work in glass factories. You take sand, which is silica, and you're cooking sand to make glass. That's one type of chronic inflammation. Asbestosis is another one, but thankfully that stopped in around the 60s when people related it to the presence of mesothelioma. Immune responses, asthma is certainly a chronic type of inflammatory process. Myasthenia gravis is the presence of antibodies against the acetylcholine receptor. The acetylcholine receptor is on your skeletal muscle cells, so if you have antibodies to it, you can't run to weakness. Your diaphragm is also involved, and people who have myasthenia run the risk of asphyxiation because their diaphragm doesn't work. Granulomas inflammation is interesting. There are two types of granulomas inflammation. One is caseous, right there, caseation, and the other is non-caseous. What a granuloma is the body recognizes this as something it doesn't want to be exposed to. So it tries to wall it off. And if the center of that walled off structure dies, it becomes necrotic and it turns into a cheese-like substance. That's what casein is, like the protein of cheese, right? And you see a couple of granulomas here that are pretty, discrete. That erysipelas that guy had the other day, that's, was just diffuse. It wasn't specifically within a thing. But granulomatous disease or granulomatous inflammation it's a walled off thing. There are different types of granulomatous diseases that are listed here. Sarcoidosis is a common one that you're going to see. Tuberculosis is present in Oklahoma. It produces granulomatous diseases in the lungs. This down here is the progression of sarcoidosis in this series of films. I wouldn't worry too much about that, not other than to knowing you can see the destruction of the lungs in sarcoidosis over time. Cat scratch disease is infection of a bacteria called Bartonella henselae, H-E-N-S, A-L-I-A, henselae or henselae, Bartonella henselae. And it's from the scratch of a cat, and it produces these big, huge lymph nodes, humongous lymph nodes, of where that area of the body drains, almost to the point of buboes, but they are granulomatous lesions within these lymph nodes. It's another reason, one of the many reasons that I'll explain to you throughout the year of why cats should be eradicated from the world. There's no purpose for cats. One of them is they harbor this bacteria. Okay? I'll go through many more of them as the year goes on. And syphilis, the type of granulomatous lesion, is called a gumma. G-U-M-M-A, a gumma. In syphilis, it's a gumma. It says it right there, a gumma. A gumma is a granulomatous lesion that occurs in primarily the central nervous system, and it affects their ability to walk. And I'll go over that when we get to neuroanatomy.